I'm very pleased to be here today, and I'm glad you can join us to share in our conversation with Vikram Savkar. I'm very excited about the topic about open medicine and open access publishing. I've focused my professional life in related areas. Research translation into actual practice is a very, very important topic, and very, very pleased to have a thorough discussion about the many, many issues and the challenges that are involved in making that a reality.
Vikram, what will it take to drive global collaboration to achieve open medicine among all stakeholders, such as funders, institutions, publishers, and researchers, and maybe others?
To begin with, all of the stakeholders in the global medical community need to acknowledge that the vision of open medicine and global health equity is one that we can only achieve collaboratively, not individually or separately. We all need to work together, publishers, funders, institutions, academic institutions, researchers, all working together to identify what each of us can contribute to a holistic vision of how medical research can be spread more equally globally and shared at all times with every other part of the world.
In the wake of the COVID-19 pandemic, will a greater push toward open medicine make the world better prepared for future outbreaks and ensure that no one and no nation is left behind?
We addressed the challenge of the COVID pandemic, whether through vaccines or through other treatments, partly because we moved beyond reliance purely on traditional peer-reviewed literature to gray literature, to real-world data, to evidence that was shared around the world more informally. And so all of those kinds of information need to be a part of the global medical research community moving forward. But we also made progress in COVID-19 because we sifted critically through that data, separating the useful from the not useful, accurate information from misinformation, to settle on the research that was credible, reproducible, and that ultimately had the potential to save human lives. These two keynotes, velocity and precision or accuracy, need to continue to be the bedrock of open medicine as we move forward.
There's an onslaught of biomedical literature, so what's keeping it from becoming more widely available today?
The volume of biomedical literature is growing exponentially, which is a very good thing. It's a sign that more and more medical research is being done in more different parts of the world. That volume creates a challenge. The challenge for researchers and for clinicians is how to sift through that enormous volume to find the needles in the haystacks, the research that is applicable to their patients. The challenge, as I see it, is for tools, whether software and technology tools or other tools, to help consumers of the medical research find what is relevant and apply it to their clinical contexts. That translation from research to practice is what we see as the greatest challenge in the framework of open medicine today.
For viewers who are interested in learning more, we have an excellent white paper which is available, which explores many of the topics that we discussed today in a lot more detail. It provides terrific background also on the history of open medicine and open access publishing. So I very much look forward to hearing from you and to having you be part of a community that's taking this journey toward achieving this vision.